Hello, and welcome to the Family Medicine Sub-Internship. This clerkship is designed to provide an opportunity for you to assume more patient care responsibility and help prepare you for residency. Because you had a robust and broad experience in your third year of medical school, there are no specific conditions or procedures required for this clerkship. You are expected to spend the majority of your time with the inpatient team, focusing on direct patient care in the hospital setting. You will take call with your resident team, although won't always be required to spend the night. You must record at least 40 patient encounters in the hospital setting, with 80% of those at the full level of participation. The specific types of encounters that are required include a hospital admission, discharge, and evaluation of a patient in the emergency department. Since this is a required rotation, you will continue to use eValue to log your patient encounters. Although there are no specific requirements for ambulatory care, you are encouraged to participate in meaningful opportunities that are available, as long as they add educational value to your clerkship. If you are scheduled for a couple of half days in the outpatient setting, try to see a follow-up visit for a hospitalized patient and participate in office procedures, really anything that broadens your experience in the sub-internship. If you are assigned to more than 2 half days in clinic per week, please contact me. You will spend most of your time in the hospital setting, starting each day with pre-rounding so that you are ready to present the patient's updated status to the team at morning report. Be prepared to write daily progress notes, although your ability to access the electronic medical record will vary by site. You should write up the admission notes for your own patients and learn to write orders. Be sure you also learn to write a discharge summary, as this will be expected of you during your internship. There is only one assignment for the Family Medicine Sub-Internship. You are required to develop one educational goal that can be accomplished during this 4-week acting internship. Be sure it is specific and that you identify targets before you begin. That will help you to monitor your own progress. You will need to find good, evidence-based resources to help you accomplish your goal. While this can be your resident, attending, and phone apps, I expect you to be a little bit more creative and find some valuable resources you've not used before. Be sure to track your progress and measure your success against the targets you selected. Then write a brief report on the experience. This final report on your personal educational goal is submitted to the student academic site and is due prior to the end of the clerkship. The evaluation rubric is included in the syllabus, and there are examples of exemplary performance posted to Blackboard so you have an idea and a good sense of what is expected for honors consideration. There is an exam on the last day of the clerkship. The NBME has 100 questions, with 80 core questions and 2 additional 10-question modules on chronic care and musculoskeletal disorders. There are practice questions available through the ABFM phone app and on the AAFP website. You also have access to FM cases and can schedule a practice exam through your clerkship director. Be sure you review the syllabus as it contains detailed information on expectations for the sub-internship. You are also expected to meet with your clerkship director at least once a week, and this can be in person, by phone, or by email. They are available to help with any aspect of this rotation, so please reach out if you have additional questions. Because this is a required clerkship, absences are not permitted. Please speak to your regional campus dean if you have any specific questions. Final grading for the Family Medicine Sub-Internship is based on your clinical evaluation, educational goal, clerkship director's narrative summary, and NBME examination. All components must be completed to pass the clerkship and must be exemplary to be considered for honors. Remediation of any component or failure to meet professionalism standards means you are no longer eligible for honors and are actually at risk for failing the rotation. The Family Medicine Sub-Internship should be a time of professional growth with increased responsibility for patient care. Good luck and have a really good time learning.